We actually talk with veterans and learn what's important to them.
They told us they felt this call to action to step up, be a part of this.
This really is about them, and so we should be doing it with them.
If we have a community of researchers and we have a sense of what the partners need help in, then we can look at our portfolio and say, are we asking the right questions?
My name is Dr. Roman Ayele. I'm a research scientist at the Denver-Seattle Center of Innovation. Older adults in general experience social isolation and loneliness, especially during the pandemic, because of all of the social distancing and all the measures that were taken to prevent COVID-19 transmission. And loneliness and social isolation actually has negative health impact. Prior studies have shown that. So we wanted to see now that COVID was rampant, how are individuals, veterans, and their caregivers dealing with social isolation and loneliness? And then how is COVID impacting their access to care? I think the broader application of this work is that loneliness and social isolation is something to be assessed because people feel it. And I think it's something that we have to actively ask in routine medical procedures or routine just appointments with patients and see if they need resources and connect them to those resources. But also that people just want to be heard, even if there is no solution, just to be asked, how are you doing? How's your social life? Are you feeling lonely? Those kinds of things, especially for older veterans and older adults in general, I think are very important. I think that's the one thing that I learned from this work. Telehealth, which we really like and enjoy, and we really expanded in a big way during the pandemic, is not really a panacea. It's not an all-encompassing solution to a problem of connectivity, because we might be ready as an institution to provide telehealth, but patients and caregivers are not always equipped to receive that care for various reasons: connectivity, Wi-Fi, equipment. They might not have updated equipment. And so how do we make sure that the services that we are interested in providing is something that would actually reach people? I think that's something that we have to figure out. One of the things that we say when we're recruiting veterans and their caregivers for our qualitative interviews is we're interested in interviewing you because you're in this clinic, and we're interested in learning about your perspective on social isolation and loneliness. And what we learn from this interview will help in developing future programs for other veterans and their caregivers. And they were all willing and able to participate, which we're really grateful for. But this is something that I see in my work every day, that veterans really value other veterans and they want to help and their families. For me, what was really surprising was that I thought people would really like telehealth, that everyone across the board would enjoy connecting virtually with their providers. But what we learned is that not everyone is interested in that. And even though they were rural veterans, semi-isolated locations, people really wanted that face-to-face interactions with their providers. And so I think COVID-19 took that away from them. The other aspect is technology is something that I think I just take for granted. I know how to turn on my computer and connect with anyone that I want. A lot of the people that we worked with, that we asked about their experiences, said, well, I don't know how to turn this on. I don't know how to connect. I don't know how to log on. And so I think that is surprising to me, but something that we could find a solution for. Veterans made the ultimate sacrifice in terms of protecting us and giving everything that they had in their life in some instances. And so for me, it gives me great joy to try and understand what veterans are going through, what their caregivers are going through, and try and find a solution to help them live a quality life, a healthier life, a better life. And so I feel very happy about the work that we do. And I'm very proud of the institution that I'm in, and I'm really lucky in that I am housed in the Denver-Seattle Center of Innovation with amazing mentors. My primary CDA mentor is Dr. Carrie Levy, who's also the director for the COIN there, and I'm just being guided by people who really have done so much work in this area and for veterans, and then now learning from them to continue to do that work is very satisfying and amazing. So I feel lucky and grateful.